All right, thank you, Jenny. All right, let's get straight to the phones here. And Representative Brian Bibray from San Diego was up late last night, voted no on this bill, but as we know now, it did pass, although barely. Congressman, what are you waking up feeling this morning?
Well, I mean, obviously disappointed that people weren't willing to sit down and try to work together. But then again, I guess when you've got such a super majority, you don't need to talk to the other side. The fact is, we've had probably 34 Democrats that joined with us that said, look, this is going to last a long time. It's going to take decades to correct any problems that we see here. And I think that it was too bad that everybody was, I think it became more of an ego game that everything has to be passed or nothing. And sadly, it's got all the sweetheart deals in it. And last night, before we voted, we found out that the so-called fixes that were promised to be done by the Senate, a lot or most of them are not going to be even allowed to be considered because of a thing called germaneness, that procedure in the Senate wasn't going to allow a lot of these backroom deals like what was done with for Nebraska and $300 million for Louisiana, which cost more than the Louisiana Purchase. Those things are all going to be sort of forgotten now, and now this morning we're even finding more stuff like a sweetheart deal for the drug companies in this, that the so-called insurance companies that everybody was trying to vilify actually have some great deals in this that nobody was talking about.
Now, so in terms of San Diego and Californians, how do you think this health care plan will affect us?
Well, it's a military town. It's sort of like my mother, who's on TRICARE. Here's the big one that's not being talked about, and the military retirees and active duty are going to be furious. This bill moves TRICARE health care away out of the armed services, the Defense Department, over to the HHS, which is the welfare department. So now military benefits are going to be treated as if they're welfare rather than military earned benefits. And that one is something that may not seem like a big deal to those of us who are not in the system. But let me tell you something. When I get home, my mother knows like holy heck that she is now going to be treated like a welfare recipient rather than a veteran's benefit.
Congressman, Nancy Pelosi said that we had to pass this bill so that we could see what's in it, and now the morning after, we're starting to see more of what's in it. Is there any chance that as Americans see more of what's in this bill, they will like it any more than they do now? Because the overwhelming majority have said they didn't like it already.
Yeah, honestly. Look, I think they'll love the idea that, like myself, I love my daughter who's in college to be able to be under my health protection. I think they'll love certain parts of it. But let's face it, the $1 trillion price tag, the $500 billion taxes over a decade, those are all things that the American people are much more concerned about than Washington gives them credit. And I think that one of the biggest things that shocked me since coming back in '06 is Washington really thinks they're so much smarter than the average American. Average American is much more sophisticated, and this town gives them credit. And the debt is something that you just can't walk away from. Anybody who's, especially after what we've gone through in the last couple of years, say, that's fine, you promised me this, you promised me that. You can't keep the promise you're making now, Washington, and how are you going to pay for the new one? And that is a really common sense answer that Washington obviously keeps trying to work around and ignore.
Now, how are you going to continue this fight? I know many Republicans are saying they'll take this into the midterm elections. What's your plan?
Well, my plan is basically to try to correct it as much as possible. And you've got situations where it's astonishing. If everybody living in the United States legally is going to be taxed, there's going to be 16,500 new IRS agents hired to track people down. Except those who are illegally in the country will be exempt from the tax. But those illegally in the country will be able to access into the healthcare system because there is no verification like under the SAVE verification or E-Verify required in this bill or even allowed in this bill. So that's a kind of interesting proposal out there that it's a double whammy kind of thing. And when those things need to be corrected, I think we all agree that anyone who gets any benefits on this we should make sure that everyone is legally here and has paid into the taxes. The little things like that really do matter, and I think it matters mostly at us showing the American people that we can't be trusted. And right now, we just look like we're really not in the game, and we're not to be trusted. I think that whole thing of trying to correct this thing is going to be a huge problem, a great battle, because Washington makes mistakes, and that's not the bad part. But when they make mistakes, Washington tends not to want to admit it and go back and correct it. They usually just say, well, the only problem was we didn't spend enough money, so we have to throw more money at it. And that's one thing that we've got to get Washington off of, and I think that's what the American people have been saying.
All right, Congressman Brian Bibray, thank you so much. Come see us when you're back in district, and I'll tell you, coming up at 8:17 this morning, we'll be talking with Susan Davis.
Well, fantastic. Take care, and look forward to getting home as soon as I can.
Okay.
All right, take care.